Good morning, everyone. Can you all see my presentation?
Yes.
Awesome. Ashok Kapoor, CEO of Hawkeye MedTech. Can you imagine living in Florida and your parents are living in, living in Maryland and your parents are living in Florida, and they both have significant chronic diseases, and you have to visit them frequently so you can take them to doctor's office for regular checkups and visits? Wouldn't it be great if they could connect to their own healthcare providers remotely and you could be part of the call so you didn't have to travel so much every time to Florida to take them to routine physical visits? Welcome to Total Care. We are a HIPAA compliant, unique kind of telemedicine platform that connects patients to their own healthcare providers on scheduled virtual visits. So it's not ad hoc visits, it's scheduled virtual visits. Since COVID-19 especially, there are a lot of news about telemedicine platforms, and everybody is jumping on telemedicine. And the concept of telemedicine really expanded beyond the traditional telemedicine. People are using Zoom, FaceTime, WhatsApp, and a lot of other video platforms as telemedicine because Medicare, HHS, and others have really laxed the HIPAA compliance and patient privacy rules. So now they're allowing even text messages to be billable as telemedicine, which is kind of interesting. But we remain true to our goal of providing a secure, HIPAA compliant, with patient privacy and real focus of our products. So competition, there are a lot of traditional telemedicines out there, some that health insurances provide where records are not transportable. Suppose you switch from Kaiser, like I'm a Kaiser member, and I have a telemedicine through Kaiser. If I were to switch from Kaiser to Care First, I would lose all my history that I had with Kaiser as far as the telemedicine. So when I go to Care First, I start fresh. So my continuity of care, all my history is gone. Wouldn't it be great that if your history stayed with you, even if you switched healthcare insurances or your doctors? So the new doctor, a new health insurance company can continue where the previous one left off and not have to start fresh. There are other telemedicine providers that connect you to on-call providers. So basically what I call a stranger doctor. Doctor you have had no relationship and no connection with. You have a fever or your child has a fever, you call this service and you get a doctor on call that gives you care for the immediate problem but doesn't take care of your whole health. Then there are other ones where they are similar to connecting you to your own providers, but they don't have a lot of other features that are very important, that is salient to us, like patient identification, jurisdiction awareness, and follow-ups, and true HIPAA compliance where everything stays within the platform. There are no text messages sent to your texting, which is outside the HIPAA compliant platform. So everything stays within a secure network, which I think is very important for patient privacy. One of the other things we focus on is simple and ease of use. Technology can be challenging to many of us. Sometimes to me, I have to talk to my daughter on how to use my phone, and she tells me all about it. So we try to make sure that our application is multi-platform, so you don't have to worry about, is it only iOS, it's Android, can I use it on the web? Yes, you can use it on the web, you can use it on a tablet, you can use it on a phone. Almost any platform that connects to the internet, you can do that. As long as it has a camera, it needs a camera and a microphone. So very simple steps. Download and onboard yourself. Find a provider. Look at what their availability schedule is. Schedule a consult. You can add chief complaint. You can add photos. You can add video. You can also add your vitals, your blood pressure, temperature, pulse, all that stuff. So the provider, your doctor, can get all the relevant information before the call starts. Then you get on a teleconsult with the doctor, audio, video. You can add a family member. A doctor, on the on the other side can also add a specialist. If I had to send a picture of some mole growing hair, they can actually add a dermatology consult at the same time, so you don't have to get one visit and then schedule another one with a dermatologist and wait a few weeks. It can all be done at the same call. One of the other important features is they can give you a post-consult plan, post-consult care plan. How many times you go to doctor's offices and they tell you a whole bunch of stuff, and by the time you leave the office, you're like, what did he actually say or she say? Did she tell me to check my blood pressure twice a day? At the same time, or do I check it in the morning and evening? Totally forgot, right? And you really cannot call back and say, hey, doc, I totally forgot what you told me. So you live with the embarrassment and you assume that what they told you, what you remember is true. But if you get everything in writing on your phone so you can refer to it later on, wouldn't that be cool? This is what a video call looks like from the doctor's perspective. They can see the patient, they can see themselves. They can see all the vitals you entered, your allergies, chief complaint, everything is right here. They can also look at your prior history to make sure they continue what's going on. Suppose you have had headaches off and on for several months. They can look at it and maybe they can come up with some kind of a different diagnosis than regular headache. It may be something, a pattern that may be worth looking into. So that's important. What are the features that doctors like a lot, or providers? I call them providers because it's not just doctors, PAs, NPs, podiatrists, and a lot of others. There is no change in workflow to use our platform. You don't have to change the way you work. You just replace the patient with our platform. That's it. The rest of the stuff you do stays the same. We have patient identity verification, so you can know exactly who you're talking to, as opposed to you send a text message on the phone and whoever clicks the phone, that the text message gets on the video call with you. Not very good. A lot of the providers say that it's a great video and audio on our platform compared to other platforms, so they can get clearer picture of the patient. And when they get an examination, when they say put the phone on the throat, let me see, they can see clearly what's going on. When they go to the eyes, they can see clearly. Very important to doing remote assessments. License jurisdiction compliance, that I think is very important, where if I'm licensed as a doctor in Maryland or Virginia, make sure Pennsylvania patients don't get to me. And not only that, when a call is about to happen, make sure the patient is within the jurisdiction that I'm licensed in. If I'm living in Maryland, I happen to travel to New York and take a call, it may be outside my licensed jurisdiction. Add a family member. One of the important things, you can collect copays right on the call, so you don't have to send a bill later on. Features that are most liked by patients: ease of use, simple to use. You don't need a lot of know-how, everything is very simple. You can connect to your own healthcare providers. You don't talk to quote-unquote stranger doctors. These are scheduled calls. So the patient knows when the call is, the doctor knows when the call is, and they get reminders, so you don't forget when you made an appointment. You can add a family member, very important for people like my mother, my late grandfather, where it was important for them to have a family member to fill in the rest of the picture about what's going on with them. Follow-up reminders are important. Doctor told me to make an appointment after 30 days, but if a reminder comes to me, I know to do that. And a call summary. That was a telemedicine. Are we just a telemedicine provider? No, we are going beyond the traditional telemedicine venues. What we are developing right now is a comprehensive chronic disease management platform. Wouldn't it be cool for the patient and the provider to get, for example, my blood glucose reading, not just when I come to the doctor's office, but actually all throughout the time when I was not there. So when I get to an appointment, they can figure out my averages over time, my history over time. And from the doctor side, from the provider side, you can actually get a history, a summary, or a dashboard of all your patients, where the critical ones are listed above and non-critical ones later. So when I come in the morning, I can take care of my critical patients first and then do the rest of my day, non-critical. So I prevent hospitalizations. I reduce hospitalization with my patient population. Another one I think is compliance. I told the patient to check the blood pressure twice a day and wait once a day. Are they doing it? What is their compliance percentage? Very important for chronic disease management. So what have we done with the, what is our focus? What do we need help in? We are focusing a lot right now on underserved and rural populations. We applied for a USDA grant to provide our telemedicine platform to Wicomico and Somerset counties. We hope to hear from them soon, got positive feedback on what we submitted. And we want to take this to other rural areas and not just Maryland, but beyond. The reason I say rural is because rural population, there are 70 million US citizens, US population that lives in rural America, and they have the highest chronic disease management issues, mental health, substance abuse, a lot of issues there in rural health because there are health challenges, healthcare access challenges, provider access challenges in rural America, and also the underserved population that I think our telemedicine solution is ripe to bridge the gap between their health and connecting them to a healthcare provider. What am I asking this wonderful group to help me with? Access to rural health connections. We would love to get access to rural health. We had a really good call yesterday with a rural health department. They were really excited for us to be there. Then if we can have other rural health connections and actually connections to providers, we would like to add more providers on the platform. So those two things are my asks from this wonderful group. Thank you so much for letting me speak, and look forward to any questions.